All right. Yo, everybody. Here we go. Starting another episode of the Mind Body Marathon. And I'm your host, Dr. Leo Kormanik. And on today's show, we have the old regular Zach Goulet.
Yep.
And then we have our special guest of Jillian Reyna, who is currently, 12, you said?
12 weeks.
Yeah, at the time of this, 12 weeks. Yeah. So 12 weeks pregnant. And so we're going to talk a bit about like women's running, women's health with running and running through pregnancy and just kind of some of the conversations, points around that. Jill is a coach as well. So what kind of athletes do you work with? What kind of coaching do you do?
So I work with really, I would just say adult runners. So anyone pretty much out of college and up. And I help anyone, mainly 5K to marathon is where I focus the most. I would say half and fulls are the most popular.
Yeah.
But yeah, really anybody from a beginner to somebody trying to reach a BQ, I kind of help anyone from all over that spectrum.
Yeah. So, tell us about your running background.
Sure. So I found running in high school. It's actually kind of a funny story. I did gymnastics my whole life and then joined the track team because my mom wanted me to meet some boys. not joking.
What terrible sport to meet boys in.
And she was like, go do pole vault because the track boys are a different breed.
Weirdos.
Just wackadoos.
But anyway, so she's like, go try pole vault because you're a gymnast.
No, what grade was this?
Freshman year.
Okay.
Right
in the heat of it.
Oh yeah. So anyway, I tried pole vault. My high school already had a lot of good pole vaulters, so I got thrown in the 400 meter because nobody wants to do that race.
Yeah.
Turned out I was kind of decent at it. And then by the end of that year, I was trying to join the distance crew, trying to figure out what the 800 was about. That led me to finding cross country that next summer. Ended up walking on Akron's team and doing cross country and track in college. And now I do halves and fulls. So.
Yeah.
You know what's crazy about that? So for anyone that's watching this, and
you guys were teammates.
We ran at the same high school and we were teammates and we went to Akron and did all that.
What was the gap in
2 years?
Yeah.
But I didn't know that story because I want to say, your freshman year would have been my first year running cross country as a junior.
Okay.
And at that point I was running distance for on the track team, but I didn't know that story because you just integrated so well onto the distance team. Like I just was like, oh yeah, you ran like in middle school. You did. I did not know that.
She had the orders from the mom.
You gotta go meet boys.
She watches it. She's gonna laugh.
Which I think with any cross country or like track team, like it didn't cease to disappoint the integration between the guys and the girls on the distance team, even in high school. It was an interesting time.
We had a blast. And I think what was the best thing for me coming from gymnastics, which is such a subjective sport with judges. It was really nice to come to a sport that did not have a judge. It was just your time, And so I didn't realize how much I needed it. But growing up in a sport that was just judgment after judgment from coaches and judges. So it was nice to come to a sport that was just like, just go run.
Clear cut.
Yeah.
Fastest time goes on.
Yep.
Yeah. And that's a good point. That I never really thought about that, like how that messes with the psyche of a kid of just constantly literally being judged.
Yeah. It definitely got to me and it created odd tension and competitiveness between, that kind of happens in any sport because it's competitive nature, right? But it really got hard when somebody was always favored by a judge on a certain event in gymnastics. So running was actually like a really big breath of fresh air for me. And I think it helped my approach when I started it. I went into it with no expectation. It was just like, this is for fun. This is something new and different. And I think that really helped me, especially, so as Zach said, we were high school teammates. We went to Hoover in North Canton. The women's team at the time was really good. I think the year that I came on and competed at varsity level, we got third in the state. So we were very, very good. And I mean, I probably could have been like top 2 or 3 runners for any other high school in the area. So the fact that I was varsity for Hoover was like a very, very big deal.
Yeah.
And yeah, I mean, like people were like, who is this girl? And I was like, I don't know, I'm just out here having fun.
Yeah,
I just
having a good
love
time.
it, you know? So yeah, it was a really good change for me.
So at what point did you, because you're an engineer, right?
Mm-hmm.
So by trade, at what point did you realize you wanted to keep running in your life, you know, after college, and just kind of expand from there?
Yeah. So after I graduated from Akron, as most of us do that have done collegiate athletics, we pretty much usually need a break from
Yeah.
after those 4 or 5 years of highly competitive, just back-to-back competition, races, et cetera, and training. So I took a break. My now husband, when I met him, he did CrossFit. So I got into weightlifting. And that was another new breath of fresh air, kept the competitive spirit alive, but totally different, something new. Loved that for a few years. But then I got back into marathon running. Well, not got back into it. I started marathon running, got back into running. One of my friends from CrossFit was like, I think I'm going to do this marathon. And I was like, oh, I like kind of want to do one, but I feel like I'm not going to do it if I don't have a friend to do it with.
Yeah.
So I remember, this is like so funny thinking back on it. I remember doing a 4-mile run and I was like, if I feel good on this run, I'm going to sign up for the Columbus Marathon. A 4-mile run. Why should that be the deciding factor? But that's what I did. And I felt good. So I was like, I'm doing it. I'm signing up. And I had such a joy getting back into running and learning so much about the sport of marathon running. It's so different, obviously, than what we did in college and high school. And I got really lucky and had a great first marathon. I feel like you either have a good one or a bad one, and I got lucky with a good one. And then it kind of lit the fire. And from there, it wasn't until, I'm trying to think, I really started thinking about coaching after my 3rd marathon. I started to have a lot of people that reached out to me, and it felt like, okay, I have an influence that I need to share with people. And I think what really motivated me to do it is, you know, you guys being collegiate athletes and high school athletes yourself in the past, you've had a lot of coaches, and you can remember the good coaches and you can remember the bad coaches. And
the tendencies of each and all that.
Yeah. And so I really, with people coming to me for that influence factor, that's when I really was like, okay, if I have the opportunity to help people, I want to do it in a positive impact way, because I don't want somebody to get that negative experience that maybe we've all had from a coach. And so I want to give them that positive experience. And that's really kind of what started it. But I don't know, awesome. It just kind of naturally happened, getting back into running again. And I'm so glad. I'm so glad I took the break and then got back into it the way I did, because I love it so much more than I did back then.
Well, it's finding that balance. It's finding that line of competitiveness to, I think, every day I want to go out there and do this because it's healthy. It's a good thing for me. It might be a stress reliever. And it's like a lot of college athletes, when they get out of it, it's like they don't want to get back into running because it's like they say, I have nothing to prove. I got nothing to prove. It's like, yeah, of course you have nothing to prove, but it's also a healthy thing to do. And it should just be integrated in your life. And
yeah, absolutely. I mean, there's so running, there's so many amazing races and events, and you know, the joy of it all. It's like, it's endless. And I can't believe that people would like limit themselves because it's not a competitive thing. Like, once you realize, like, and it never really should be, it should just be about like challenging yourself. And, you know, if running really is just a tool for you to learn more about yourself and craft yourself, then it's a lifelong thing. It's just, you know, it's just really just a different stimulus for that.
Yeah.
So you have a little one. So how old's your daughter?
She is 19 months. So for those of you that don't count in months, that's a year and a half.
Yeah, I know.
I know. Before I had kids, when even with pregnancy, people are like, "How far along are you?" And you're like, "I'm 25 weeks," and you're like, in normal time.
That's me. That's me.
So yeah. Anyway, she's a year and a half, a little over.
Yeah. So in your first pregnancy, you ran with her, right?
Yes, I ran with her through about 26 weeks. It went well. You know, I obviously had to start making adjustments, slow down, turn to run walking quite a bit. Ultimately, what led me to stop is I just had a lot of bladder pressure. I felt like I needed to go to the bathroom all the time. And that just became uncomfortable. And kind of to your point, it was no longer enjoyable. So I switched to walking, cycling, and weightlifting at that point. But I loved it while I could. And I really enjoyed, I actually remember going on a run and like talking to her, like, you know, knowing she was with me and just being like, hey girl, like what's going on? And like, I did that the other day. Obviously I don't know the sex of the baby yet, but like, you know, sometimes when you're out there alone, you can just like have a little chat, and it's cool to have that like connection. And that's the thing I love about being the mother, is that, you know, that's a connection that I get and only I get. So it's kind of a special thing.
That's a beautiful thing.
Yeah.
Yeah.
Yeah, I know it's a bit, you know, you ask different OBs and you even Google it, should I keep running during pregnancy? It's obviously a very divided answer.
Yeah.
And the ultimate answer really just comes down to your risk factors, obviously, you know, based on, you know, how things are developing and how you're feeling. But I would say all in all, most OBs are pretty accepting of having people run through a pregnancy.
Yeah. I know mine, she is very big on like, what was your baseline before you were pregnant? So like last pregnancy, I actually was I was doing more running before I got pregnant and less weightlifting. So I remember I stuck to the like 30 pounds, which thinking back, like it's kind of ridiculous that I only lifted 30 pounds that whole pregnancy, but like I stuck to it and I was like, that's what they said. This time I was lifting quite a bit before I got pregnant. So I'm still lifting.
Yeah.
I'm lifting way more than 30 pounds. Now, am I trying to PR? Am I trying to do what I was doing before pregnancy? No, but I'm like, I did lunges the other day at 85 pounds. Like, you know, so it's just do what feels right. If it starts to feel like you're bracing your core too much, or, oh, that felt like too heavy, then just be smart. And it's the same with running. You know, I was doing some runs on the Peloton earlier in the pregnancy this time around. And I was, you know, they give you some on the classes. They're like, all right, let's pick it up. And I'm getting into like, I don't know, sub 8-minute pace. And for me during pregnancy, that's a little fast. Like that's pushing it. And my heart rate's going up. And then I get off and I was like wiped. And it's like, okay, that's not necessary right now, you know? So, and just again, kind of level setting, like what's the purpose of this right now?
Right.
I'm not trying to do anything except move my body and get some like stress relief, or just like continue to move, you know, and stay healthy. So yeah, back to your question, sorry for diverting, but my OB is very, very, accepting of me, and I'm sure others, moving during pregnancy and running. And she really just is like, listen to your body, be smart.
Is there like when someone is like if my wife was pregnant, and is there like general guidelines, or is there like specific testing that can be done or be monitored, like vitals or whatever, that can like kind of guide that into a more specific type of like routine for that individual?
Yeah. So, I mean, as far as like Leo said, if you're a high risk pregnancy or something of that sort, then they're going to give you those specific guidelines. Luckily, I have not fallen into that category with my first.
And that's usually associated with age, like a high risk being like age, or a precondition that you might have a health condition prior to pregnancy that could compromise the health of the child.
So it would be advocated to get testing
done.
Or
one final thing would be if you had a previous pregnancy and you had like preeclampsia or placenta previa, which are some different dynamics that can happen with the placental wall, then those are sort of risk factors for maybe being a little bit smarter the next pregnancy. Okay. So I don't know if they would do if they do testing per se. I think it's just more based on like history, and obviously if you do an effort and you notice bleeding or something like that, like you have to be really like cautious of that.
Yeah, I mean,
so pain and sort of like
of questions coming up.
The general guideline though, as far as like with running, because like I said, I gave the weight guideline with lifting. They just try to say keep your heart rate around or under 150. So that's I mean, we all kind of do that with easy running anyway, right?
Yeah. So you're not really hitting high intensity stuff.
Yeah.
No.
But the other thing too is like just general running increases about 2 to 2.5 times pressure in your intra-abdominal cavity. So at any given time you have pressure in your abdominal cavity. A general run for even the normal population without being pregnant that increases up to about 2.5 times per landing. So obviously when you're pregnant, that goes higher because you're fitting a baby into that small area. But what will end up happening is because of the increased intra-abdominal pressure when you're running, that goes up to 2.5 times, that for the average runner that is not pregnant, that actually becomes a strengthening tool for the pelvic floor.
Ooh, cool.
But if you're pregnant, it becomes like, a little bit too much weight to the pelvic floor.
Yeah.
So it actually technically weakens it.
Right.
And so it can provide a little bit of an enhanced stim. It's like lifting beyond your capacity to lift. It's basically you can irritate the muscles too much to the point where they can't handle the load. And so, that's what she was mentioning. We got 26 weeks in or so, and it just wasn't normal, just didn't feel right. And so, yeah, it's just at that point, the pelvic floor is struggling to kind of handle the pressure and just kind of read the writing on the wall.
Yeah.
Interesting.
Absolutely. Interesting. Yeah. It's, I have another question actually. And
I love that smirk.
So like, if a woman is having just like a really hard pregnancy, like sick all the time, would it be advised to actually move more to get more blood flow going, to like get the body moving
yeah, I think that's a great question actually. And I think that kind of goes back to potentially what kind of sickness you're getting. Like if you get nauseous, like, for instance, we were talking about this earlier with you. If you get nauseous thinking of food, well, that's different than just being nauseous.
Right. Yeah.
If you're always nauseous, then probably moving would make that worse.
Right.
But in theory, yeah, moving would actually be somewhat therapeutic for all the different hormones and kind of, especially if you have a little one like Jill has. It's like, you already have a lot of stress going on, and it'd be nice to get out and get some alone time and get the heart rate up and that kind of thing. And I think that could be beneficial. What do you think?
Yeah, I think movement is always good. And like, I know I cannot wait until the weather warms up a little bit, just so even I can go on like more stroller walks because sometimes I think, to your point, like I know in my first pregnancy when I was pretty nauseous, when I would run, it would almost like take my mind off of it and I would feel better or forget about it for 30 minutes. I think it's kind of the same this time too. When I've had my food aversions, I feel like, I don't know, it's kind of just that oasis when you move your body, you just kind of forget about the things around you, which is kind of nice. So yeah, I think movement can never help, but I think it definitely depends. Like, I think if I was super ill all the time, I would probably not be running and I would probably just be doing a lot of walking or light cycling, because think about if you had like the flu or a cold, like what do you want to do? Well, you probably don't want to go like do a hard tempo run. You're like, but I can go manage like a 30-minute walk. So I think it just, again,
it's important to move and important to,
there's no right answer, but I think it's just listening to your body and doing what you can.
Yeah. It is pretty rare for somebody to be able to run all the way up through the end, the labor, but it does happen. Most women sort of feel like, I think the third trimester is about time for me to back off.
Who was the professional runner who ran the 800 and
what was her name? She ran pregnant.
Was that recent?
It was
because I kind of remember what you're talking about, but I can't.
Oh gosh, I don't want to like butcher her name. It starts with or her last name starts with an M. But man, she was pregnant.
Yeah.
But she still ran like.
Oh yeah, you were right.
Alicia Montano.
Yeah. Okay.
Nice. You were close.
Yeah, those images are phenomenal.
Dude, it's incredible.
Wow.
Yeah.
It's wild. I do kind of remember that.
That wasn't that long ago.
Yeah, well, that's actually the high intensity stuff we were just talking about. Probably a little risky, but I don't know if I would do that.
No.
Yeah. So, okay, now walk us through like, typical mileage per week for you when you're not pregnant, and then kind of what that looks like now while you're pregnant.
Sure. So I am a very low mileage runner. I'm very similar to you, Leo, I run 3 days a week and I cross train the other 3. I obviously did higher mileage in college and in high school, but I just have found that this is what works for me.
Makes you happy.
Yep. I don't, knock on wood, get injured as much. It doesn't feel like cumbersome. I enjoy when I get to run. So mileage I would say anywhere from like 20 to 30 miles a week. So it's low. Yeah. And yeah, people point their finger at me and say that that's not the best way to do it, but it works for me. So that's what I do. Obviously if I'm training for a marathon.
Such a weird thing to get.
I know. I know.
Like, it's so weird. And I feel
weird.
like it's weird too, because I feel like it actually is a different response for you potentially as being a female too, because I feel like when I tell people that, they're like, that's amazing.
Yeah,
And
no.
then you get kind of hate from it.
Yeah, people tell me that I'm a unicorn and then that won't work for other people.
Yeah.
That's usually what I get. So
And you go,
I guess
okay.
it's kind of respect that like, wow, that's amazing that you can do that. But they also come at me and say like, but you're higher risk for injury and all this stuff. And I'm like, but I'm not just like sitting and doing nothing on those
Right.
days in between. Like I'm
Right.
still getting in
Yeah, that's
volume.
such a weird thing to say.
That's where you just smile and nod.
Yeah.
I mean,
Okay.
you know,
And-
Sean Peterson used to run 20, 30
Yeah.
miles a week and broke 4 off that. So it's like,
Well, isn't like, I
you
mean,
can do it.
doesn't like Parker Valby
Yeah.
run like
She
20
doesn't.
miles a week? And
Nah, I don't know about that low, but she does run really low.
Yeah.
And cross trains a ton. But
it's something low where it's
Yeah.
like, how is she staying? It's like,
Yeah. I don't know her exact mileage, but I know she's doing at least like 3 days of cross
you
training.
just have to get to the line healthy and
Right.
enjoy it.
Yes. Yes.
And
So, I mean, when I'm marathon training, obviously I get up a little bit higher, but like I would say on an average, yeah, it's 20 to 30 miles a week. And that's perfect. It's like I can still be a good mother and not be so exhausted. Cause that was the biggest eye opener this past year when I was doing some marathons, while having Araceli be, 9 months to 15 months. Like, guess what? I do a long run and I don't get to lay around and rot all day. Like, no, I have to like come home and be present and playing.
Yeah.
There is no sitting around like the old days. So like those days are gone. And so, yeah, it's nice to like if I'm not training for a big race, having like 10 miles as the max is great because I can.
The other thing too that Zach and I have been obviously working on athletes for a couple of decades now, and it's like when you see runners that have aged, especially mothers that have aged with running, if they've been doing it for a long time, they're running through their kids being through school, then they keep running, and when their kids are out of school, and then they have more time and stuff like it. The higher mileage ones, they're so burned out. I mean, their hair is falling out. Like they're stressed. They're so cortisol ridden. It's ridiculous. And I think it's just smart to just be like, look, life is hectic. I have a full-time job. I coach on the side. I have a daughter. I have a husband, and I have another one coming. And it's like, I'm just going to do 20, 30 miles a week, and I'm just going to continue to enjoy the sport.
Mm-hmm.
And then next thing you know, 20 years from now, you'll still enjoy the sport because you didn't burn the candle at both ends early in your career, like sacrificing yourself for some arbitrary mileage,
Well, and even on top, like my sister-in-law just gave birth in August. So they have a 6-month-old. And she tells me all the time, she's like, it's just a moment right now. Like we'll get some consistency like in what our life was in X amount of years or however long. But right now it's like a moment. And it's like, you don't need to push it. Like, don't need to push it to try to get whatever you're trying to accomplish. Like just ride it out. Let it be, what it is for right now. And you can get back to it.
Yeah. Absolutely. Yeah. And I think that's so true. And so then to your question about what I'm doing now, not much, to be honest, because I haven't been feeling the best, but now that I'm starting to feel better, like this week I've been doing run walk intervals partially for my pelvic floor to keep it happy, partially because that just sounds nice. So I've done like 2.5 miles the past 2 days, and I'm going to a group run tomorrow. Probably going to do like 3 to 5.
Yeah.
You know what? That is less than 10 miles. I don't care.
Yeah.
And you know what? I'm just so happy that I can go out and do I literally did 3 by 7 minute run with a 1 minute walk. And that was great. I did that yesterday. Yeah. 2 days ago, whatever day it was. And I enjoyed it. I had fun. Oh, well, I don't, I'm, again, to your point, I have nothing to prove. Like, I'm just happy to keep moving. And I didn't do run walk intervals last pregnancy much until I was miserable. So I'm hoping this time, starting earlier, maybe I'll be able to run a little bit longer because I'm approaching it differently. That's my hope.
Do you have any run athletes under you that are pregnant right now, or
nobody's pregnant? But I've helped 2 women now who were postpartum coming back. So I've been able to help them, and that's been really cool because I will raise my hand and say I made mistakes when I came back postpartum, and I will not make those mistakes this time around.
What were some of those mistakes people can learn from?
I rushed back too quick. Kind of like we were talking about, like, it's like, what's the rush? What's like, why are you doing all this mileage and for what? So part of it was that I had qualified for New York City Marathon, and I was trying to use my qualifier last year, the first year, so in 2023. My daughter was born July 4th, and the race was November 4th. So that is 4 months exactly on the dot.
Yeah.
And I thought psychotically that I would be able to do that.
Not surprising.
But I tried, and my coach was very patient with me. And, right at my 6 weeks, I got the green light, and I did. I felt good. She gave me run walk intervals. And then after 1 week, and I was like, I think I can go bigger. I can do more. And she's like, I don't recommend it. And I'm like, but I want to. And she basically, I told her, I accept the risk. I accept if I get injured, I want to try. And she was like, okay. And, that's not her fault. She tried to warn me, and I said, no, this is what I want to do.
Yeah.
And then I quickly realized, you're an idiot. This is not happening.
So what were your initial kind of red flags?
I remember I did a 6 mile run, which 6 is not too far, right? But after having a baby, that's quite a bit of distance if you haven't been running.
Yeah.
I did a 6 mile run, and I felt decent during. I remember that night, my husband and I went out to dinner, and my pubic bone area was just aching.
Ooh.
Aching. And I was like, oh no, this is not good. And, I took maybe a week off after that, tried again. It still kind of stuck with me. And honestly, unfortunately, so I ended up running New York City a year later in 2024, had a stellar race. I mean, I ran that race so smart. The night of the race, laying in bed, my pubic bone ached.
Oh, man.
I think this will be with me forever, unfortunately. Yeah. And I don't know if it's because of that dumb mistake I made coming back too soon, or if it was just the trauma, we'll call it, from carrying a baby. I might just always have that.
Right.
But I think it could have been handled differently coming back,
Yeah, I mean, after pregnancy, you don't really know when the dust settles what kind of body you're left with.
Right.
That's one of the big things, right? Is that a lot of things change. A lot of tissue, went through some different changes, and hormones have changed, and some body dynamics. So it's you just have to be patient with yourself,
Totally. I mean, I'm sure we've all kind of heard before that you are a different woman after you have a child. And it is so true. Mentally, physically, emotionally, so much changes. And I think it's the whole bounce back culture. You think, oh, I can just bounce back. And it's first of all, we've said, but why? What's the reason? And then kind of what your sister-in-law said, it's a phase. This is first of all, I wish, looking back, I wish I wasn't in such a rush to get back to running, and that maybe I would have spent a little more time with my itty bitty baby on my chest sleeping, and those are the things that, I mean, saying I'm sure I'll be the same way, because the postpartum hormones are crazy, and you're I need to do everything right now. Right. But yeah, I mean, those are the things I wish I could have heard and listened to a little bit more, is just rest, just enjoy this moment. Running or whatever, lifting, whatever it is, will always be there.
Yeah.
Enjoy this time with your child, because it's precious, and your body also needs the break.
Right. Especially when you're from the background of high competitive environment with gymnastics, with running. I mean, obviously, if anybody knows who you are, you were involved in a lot of different organizations, a lot of different things, especially with your sorority. So you are someone who has been able to manage that and been able to continue to be successful in whatever way that is. And yeah, so for you, it's you want to get back to those routines again, but so for the people that are very motivated, it's okay to take a step back, and rest and let the body heal.
Yeah, and I think that also plays into the psychology of not being bitter about your kid. Sometimes you'll have a kid and you're sort of frustrated that your whole routine is different, that you're sacrificing so much of yourself and your time, and it's just admitting to the fact that this is a season, this is not forever. Let's build a great connection, and then create a for a lasting foundation for a relationship, and and then we'll move on from there. So you kind of mentioned earlier about some sickness, morning sickness stuff. So walk us through how you're sort of managing that through being active and how you did last time as well.
Yeah. So I think actually, like, I used my first pregnancy, I used the marathon metaphor for so many things, like getting me through the pregnancy.
It's amazing.
And I still do. And I think something that's really helped me, that I feel like I don't know, before I started marathoning, like I didn't know how to carb load well, for example. Like I didn't know, I remember before big races, I would be like, chicken breast, like that's not helping you. Right. So, anyway, like I just have to remind myself, like right now, the body wants carbs. I eat a bagel like every day right now because that's what sounds good. Chicken does not. That's fine. Um, and I remember one of my friends telling me, like, baby's gonna get what baby needs. Just fuel yourself so that you can eat.
Yeah.
Don't try to eat things that are gonna make you ill. And so I really just, I mean, there was a week where I was literally eating yogurt and bagels or some type of bread.
Yeah.
Is that what like the doctor ordered? Probably not, but at least I'm eating,
Yeah.
not losing weight. Like, and so anyway, yeah, I honestly feel like I'm fueling for a marathon. I'm like, this is one big carb load. That's what I'm doing. Like graham crackers, fruit strips, bagels.
Oh man, that middle
like,
school lunch right
I was
there.
gonna say,
Yeah.
them kids are jealous right now.
like
Just
cereal.
Going
Yeah.
down that
Your
fruit snack aisle.
daughter's like, wait a second, that's my snack.
No, literally every time I'm eating, she's like, "Hey, mom." I'm like, "Man." So
You just
yeah,
slowly push her away.
Uh-huh.
Like, just get out of here.
yeah. So I just eat what I can and what sounds good, and
Fruit strips. I love that.
fruit strips are the best. Got one in
I
my
know.
purse right now.
I know there's the healthier versions of them too.
hmm
That's awesome.
So good.
Now, but nausea, are you getting much of that?
No, I mean, I guess it depends on how you define it, but mine, I would just say it's like food aversion. So a lot of food doesn't sound good, like vegetables, protein, and then yeah, if I think about a meal, like sometimes I'll be like, no, I have to have that right now. It's kind of
Yeah.
like the craving thing. But if I think about it too hard, then I'm like, I can't. And so that's where the nausea comes in. And it's like, okay, if I think about this much harder, I'm going to need to leave. But yeah, no, I mean, for the most part, I've been decently okay.
Yeah, that's good. I know some women that have had, I mean, even have had to go to the hospital because of dehydration, because they just can't take anything in. And one of my reproductive physiologist professors when I was in grad school said that she did all this, like she was retired from research, but she just was teaching at the end of her career. But in her early research, she was saying that what they found in the lab was that women who had a harder time during the pregnancy with morning sickness and food aversions and nausea and all that, and they ended up having better actual birthing experiences.
Interesting.
And the reasoning is that the more aggressive the body tries to purge the placenta and the baby early in the pregnancy for the morning sickness, the deeper it actually grows into the uterus, which actually makes it more of a healthy slough off when the birth comes. And I always thought that was interesting. And I've kind of like low key tracked that with people that I know throughout the years that have been pregnant. In cases where the morning sickness was like, okay, maybe a little bit there, they tend to have a little bit more harsh actual birthing process. But the ones where it's like rough, and then a lot of times it ends up going pretty smooth in the end. So it's like pay me now or pay me later.
Yeah, that's very unique.
It's not every time, but it's like a good majority of the time.
Yeah. I mean, it makes sense. I just never thought about that.
So you mentioned earlier a big red flag for this conversation, that's pelvic floor. So what are some of the things that you had to do to kind of manage that?
So I started seeing a pelvic floor therapist. I did not start seeing her until postpartum because I honestly didn't know that it even existed, which I think is probably a pretty common thing.
Yeah.
I don't think it's talked about enough. I think it's becoming more talked about, which is good.
Well, it's becoming more talked about because it's becoming better. Like the therapists are becoming better at their work.
Yeah.
It wasn't always that way.
Yeah. And I went to two different people. Like the first one I went to, I didn't feel like it was effective and I felt no change. And so then I actually ended up finding a different one, and she's way farther of a drive, but she was so worth it. And I started seeing her weekly. And it's all the way down in Belden in Canton. So like
Mhm.
not like 45 minutes for me
Yeah.
every time I'd go there and back. So I mean, it was not easy, but it was worth it. And so yeah, she did a lot of, so I had a C-section. So she did a lot of scar work with
Mhm.
me. I think that's definitely a big piece of why like my pelvic floor muscles get so tight, because it's a lot of scar tissue that's
Yeah.
pulling on everything.
Mhm.
So that was huge to work on the scar. That's something I even started doing at home. Is she was like,
Good.
hey, just get like silicone cups and do it before bed. And I was like, okay, that's super easy to just work on that. Something you don't think about. So yeah, I started going weekly, and then we got to the point where it was like 2 weeks monthly,
Yeah.
and then as needed. And I did that through like about a year. Thought I was off the hook. And then, yeah, when I started training for New York City and really bumped up that mileage again, I had to go back and see her because it started just, again, everything gets tight. It's like anything, right? So if you have like tight calves that pull on your shins, you got to like stay regular with your physical therapist. And it's kind of the same thing. Like, I just think this is going to be unfortunately something that I deal with running kind of forever if my mileage gets high enough. But yeah, so pelvic floor like really, really helped me.
That's great.
Yeah. Yeah. I mean, imagine if you tore your hamstring, there's going to be a rot amount of scar tissue in there. And it's just a matter of like, it does pull on the bone, it does pull on the other tissue around it and compromises nerve function and all that. And so, it's going to kind of be a weak link essentially.
Yep.
So what about your core work? Are you doing core work right now? And
Not a ton right now. Well, I guess.
so what does the pelvic floor therapist have you doing for kind of core stability through the pregnancy?
So I haven't started seeing her yet.
Okay.
This pregnancy, she said about 20 weeks, unless I get pain before that and need to come see her. So I've just kind of for this first trimester, I've done my normal weightlifting stuff, like what was prescribed by my strength coach. And now that I'm further along, like the first few weeks, I was fine to do the stuff. Now I'm really starting to back off on things because I can just tell it's too much. And for any people listening that are familiar with kind of the coning effect that happens when you're pregnant, I mean, it's what it sounds like your abs, because of the what's it called, diastasis recti.
Yeah.
Because that starts to happen, your core that normally is flat, it like really comes into this cone, and it's kind of weird when it happens.
Yeah.
You're like, oh, that doesn't look right. And so if I start to see that, if I'm doing something, I just immediately stop.
Yeah.
So I can still do like side planks because the obliques, those are fine. And it's actually super important for our obliques while we're pregnant to stay strong. But I really lay off of just like anything. Like for example, if it was like a hollow body hold, like that's a no-go right now, because that's
it's too much pressure.
Yeah.
It's too much intra-abdominal pressure. Yeah. So basically, obviously the womb sort of grows out, obviously in all directions, but mostly forward towards the belly button. And when that's the case, it'll sort of peel apart the abs, and potentially you can get a little bit of inner contents can push out a little bit afterwards. So that's called diastasis recti. The muscles that sort of wrap the torso from the rib cage down to the pelvis are called the obliques, and they'll sort of like, literally saran wrap in the diastasis recti. So if you have anything, and this can even happen to males as well. So if you're doing like a sit up and you notice like a little bit of coning, like you said, or pushing out of some soft material in between your abs, just north of your belly button, or even south, but mostly north of your belly button, then you have diastasis recti, and you need to work a ton on, like she said, oblique work. So like side planks with rotation, blocks and chops. You can check out some of these exercises on YouTube. On our running rehab page, we have a specific series set up for the obliques specifically. But yeah, it's like very important to keep these muscles that sort of saran wrap the torso locked in and activated.
And I thought, some women, when they get pregnant, like you can see the separation. And I thought I was like safe because I didn't have that towards the end of my pregnancy. I was like, oh, sweet. I escaped it. And then I remember going to pelvic floor and she stuck her calf or hand in between. I was like, I did not escape it. Like, it's definitely there.
No one does.
Yeah, no. But like, to your point, by the first few months, especially while I was still breastfeeding and everything, all those hormones were still there. It was definitely still visible, I guess, or noticeable. But as soon as I remember my pelvic floor therapist saying, like, once you stop breastfeeding, so much is going to change and you're going to feel like so much better. And I was like, yeah, okay, whatever. But like, no, it was crazy. Like as soon as I stopped, I was like, everything just went like it's like I
Yeah.
tightened up because
Wow.
that relaxin hormone like is gone.
It's gone. Yeah.
And so that was when I really noticed. So really for me, like I stopped breastfeeding in June because I made it like 11 months. And so after that, everything I really started to notice like, okay, now I feel like I have my body back that I had like pre-pregnancy. Obviously it's never the same body, but like it's a lot more similar. So
Yeah.
Yeah.
Some we'll never
Yeah.
experience.
Yeah, I get it. I have a diastasis.
I know. I heard yesterday. I was.
I do actually have a little one.
You got a little guy.
Yeah, I need more planks
I
and
know.
chops and blocks.
You have a father figure because I heard dad bod's not the right term. It's a father figure.
Oh wow!
that's the new thing.
Wait, are you saying that I have one?
We have father figures.
Oh, well, I'm not a father, but I do have a father figure. It's father figure now. Why can't we say dad bods? What's wrong with dad bods?
I don't know, man. It's
it's that world.
It's
You're gonna hurt somebody's feelings.
So tell us about your coaching. Rise and Rain is what it's called.
Yep, Rise and Rain. So do you want to hear how the name
Yeah,
came
let's
about?
do it.
Okay. So obviously I wanted something that was bold and I don't know, sounded motivating. And so two things. First, my maiden name is Roth. My married name is Reyna. So the two R's represent that. Reyna means queen in Spanish, and reign, one sounds like Reyna, but also to be a queen or a person of royalty, you are reigning, right? So that's kind of where that came from. But really, like the phrase "rise and reign" is supposed to mean like ultimately enjoy the process. So my slogan is rise to the challenge, reign in the process. So you have to want to do something. So the rise up, go for the challenge, and then reign in the process. So it just really like what I try to preach to my athletes is that it's not all about the finish line. Like obviously that's an amazing piece of it. And that's where we want to get. But it's like we've talked about this whole time. Like if you're not enjoying the process, then what are you doing?
Right.
And so that's really like what my coaching philosophy is surrounded by. Like I want everyone to enjoy what they're doing. I want it to be fun. And yeah, I love it. I'm so glad
So you do training and nutrition?
Yes. So I don't do the nutrition. My next door neighbor actually is my dietitian.
That's awesome.
So
right there.
Yeah,
it's not the one that makes the cake pops, right? Because your neighbor makes our cake pops all the time.
No, but yes, I forgot about yes. She's also my neighbor.
Do you guys ever like open up your windows and like yell back and forth for like?
Dude, you have those like tin cans with the wire.
We have joked, so
like,
we should do that.
Like Spanky up.
Yeah.
We should do that.
Have some walkie-talkies.
We've talked about how we should build like a bridge between our houses.
Yeah,
like, and
you
just
should.
or
tunnel.
Yeah.
That'd be fun.
Little rascals. I love it.
Oh yeah. No, but yeah, when I was excited about starting the business, I told her one night we were hanging out with them and she was like, you're going to need a sports dietitian. And I was like, you're right. And she was like, no, really, do you want one? And I was like, yeah. And then it just kind of naturally happened. Which,
cool.
That happened quick.
Yeah. It was, I started it and that was within like a month.
Yeah.
So the nutrition part came pretty much like we're a package deal at this point.
Yeah.
But it's been great. And she is like my big sister. She's become like through coaching together, we have become such closer friends, which has been awesome. And yeah, she's like my sounding board. She's, she's like, it's good to have somebody in a business venture that you can lean on and trust. And so she's been great. But yeah, I'm so glad I went for it and decided to do it because it has led me so many people into my life that I didn't ever think I wouldn't have ever connected with so many of them if I didn't do it. And I think that, I know I've learned so much about myself. I've learned so much more about the sport. Yeah, it's been a really great venture thus far.
Awesome.
Yeah, that is really fun.
So as we're rounding third in the episode here, do you have any final points or final tips for anybody that's kind of walking in your shoes or potentially going to be running through pregnancy or kind of experiencing the process or first-time mothers?
I feel like it's a repetitive phrase, but give yourself grace and be patient. it's pregnancy and postpartum and motherhood is a journey and can be hard, but it's so joyful. And I think it's just all about your attitude and your perspective. Um, you know, yeah, it's challenging, but I think it's just all how you look at it, right? Like,
Mhm.
if you look at it like, okay, I am this child's world and I am so lucky to be their mother,
Yeah.
then it's going to change perspective of, wow, this child is just like really stressing me out and it's
Mhm.
a lot. And, I'm not saying I'm perfect, but I think just I really have to remind myself, like, I get to be the sole provider for this little girl. And that is like such a blessing.
Yeah.
Um, and then, yeah, I mean, with like my fitness and movement, like as a mother, as a pregnant woman, postpartum, just being thankful for what I can do. Sometimes when I coach, and I'm sure you guys as medical providers, like you hear people whine about their fitness
Yeah.
and the woes. And that's something that I've really, again, tried to like reframe my perspective. Like, of course, we're all going to have bad days out there. Running is not an easy sport. But it's just being grateful to get to do it because I've had it taken away from me
Yeah.
due to growing a human and coming back, and it wasn't an easy journey back. And I mean, gosh, I did so many treadmill miles on like my lever to reduce body weight, and that wasn't ideal. Like 12 miles on
Yeah.
the tread is not fun, but like I'm just thankful I get to move and
Mhm.
thankful I get to do it. And so, just being, like I said, being patient, giving yourself grace, and just being grateful for the experience, whatever that is
Yeah.
that you're doing.
Yeah, that's
So,
great.
putting on your coach's cap here, any good tips or suggestions for people listening?
Go for the goal. Try it out. Like the time is now. I think we all wait for the perfect time to get started. That just try it now.
Yeah.
There is no perfect time. And just, yeah, I don't know, set a goal and go for it. And as a coach, obviously I'm here to help. I'd be happy to help anybody that wants
Yeah.
to try for something new. So yeah, challenge yourself.
Pat Porter, who is a many-time cross-country champion for the U.S., and competed in many world cross championships. He used to always say, "If not you, who? If not now, when?" And I love that.
Yep, absolutely.
It's just like, just go for it. I love that. Zach, you got any final little points?
Yeah.
Zach's about to go out for his run, so he's
Yeah.
antsy.
For all you dad bods out there,
Father figures.
Figures, work on your diastasis because your wife has to do it. Support your wife.
I know.
Support
Do
your
diastasis training together.
Yeah, because you got it.
Because you don't got an excuse.
Yeah, you got to do it. But yeah, just be supportive, be there, whatever you got to do. Clean the cat litter if you need to because they can't do it. You know?
Exactly. They don't. Yeah, stay away from cat litter.
Yeah, that's an important. Yeah,
That's a good tip.
Yeah. So yeah, that's all I got. But yeah, just yeah.
Awesome. Well, this was a fun episode. Jillian, thanks so much for coming on.
Absolutely. Thanks for having me.
Yeah. So till another week, everybody. Thanks for joining us. Dr. Leo here. Be sure to check out my new book, Faster Without Fail, Your Guide to Overcoming Injuries and Running Faster Than Ever. It is now available on Amazon. You could read reviews on the Amazon. You can check out what other people have said about it. But basically, if you want to revolutionize your running form and better understand how to stay injury-free within the sport, this is your guide. Feel free to reach out and let us know what you think of the book. I would love to hear your feedback. But again, please check it out on Amazon. Faster Without Fail. Appreciate it. Dr. Leo here. If you want to catch me in another setting, be sure to check out my YouTube page, Running Rehab, where you will find exercises on how to stay healthy with running, how to improve your running form, and a bunch of other tips and tricks on how to get over common injuries.